Technically, there is not a scarless facelift because when we make an incision, we histologically, if you look under a microscope, there is a scar. But when people say, is there a scarless facelift, what they really mean is there one that you can't see any scars? And the answer is yes. I do a scarless facelift, I call the inside out facelift, where a lot of the work is done through the mouth, behind the lower eyelid, and then through sites that allow me to get to certain areas through the hair, and I close those areas with a stitch or two, so you technically have a scar, but you can't see the scar. So in terms of, is there a scarless appearing facelift? The answer is yes, but technically there is a scar. An endoscopic facelift is basically a facelift that's done with smaller incisions, so you have access to larger tissue areas. You have an endoscope, which is a lighted camera in one hand, and in your other hand you have a surgical instrument. Endoscopes have been used for facial surgery. I started using them around 1990, 1991. We first did brow surgery, then we did cheek and mid-face, and now we have advanced to doing even lower facelift surgery through incisions in the mouth, inside the mouth, so you don't have an external scar. So the endoscope has many advantages, especially in the beginning when you're learning all that anatomy, and then later to be able to do a facelift without having scars with someone that has a lot of experience with an endoscope is a huge advantage for people. Technically, you cannot have a facelift without a scar, but what most people mean by that is a disfiguring scar or a noticeable incision. So the answer is you can get a scarless facelift, but you're going to have hidden areas that were accessed. So for instance, I might make access in the hair or back here and put an endoscope in, or through the mouth make some incisions. When those incisions heal, they will technically have a scar. But if you can't see them, and you can put your hair up and you can get out of a swimming pool and you can wear earrings and do other things, you don't worry about people seeing any scars, that's what people consider a scarless facelift, and in my hands that can be achieved. Please make sure to subscribe. The best way to prevent unsightly scars when you have a facelift is to look at a lot of before and afters of the surgeon you're considering and make sure that he has not only a technique but surgical skills to give you good scars. The other way to look at it is to do a technique that has no visible scars, and that is a combination of endoscopic and intraoral, where you have lots of access areas to get to the facial tissues, but there are no external unsightly scars. So your ear looks normal, behind your ear looks normal, you can put your hair up. So the best way to have a good scar, so to speak, is to prevent it in the first place. And then after that, if you do have a scar, we do have some treatments with an unsightly scar where we can inject steroid medicine or something called 5-FU. There's lots of different treatments with a laser. And unfortunately, sometimes people refer to me and I have to excise their scar, and I tell them we're going to go from a bad scar to a good scar, and that's a lot better result than having an unsightly scar. Make sure that you see a surgeon, because there are things that can be done to help improve the scar as it's healing. If you just wait for it to be done, there's not many things we can do except excise and go from a bad scar to a good scar. So try to prevent the bad scar by working with your surgeon. A minimal incision facelift is a term that usually refers to an incision in front of the ear and behind the ear, but not into the hairline. So it's a shorter incision than the traditional incision. A lot of times when a person makes a small incision, unless they're using advanced techniques to be able to go deep plane and through the mouth and behind the eyelids, they're not having access to the important structures that have to be recontoured. So I like to say with a mini lift, you get many results. Facelift scars are traditionally done through the hairline, in front of the ear, behind the ear, and into the hairline. So they're usually visible. To make them not visible, if you're using that same approach, by not having tension on the skin, will make those scars not as noticeable. If you do have scars because of your surgeon's technique, there are things you can do. The best thing to do is to prevent those scars from being unsightly. So if you put access in the hair in different areas and you go through the mouth and you go behind the eyelids, those are all access points to do surgery on the face that is going to be truly scarless as far as appearance goes. Anytime you make an incision, there's technically a scar, but the real key is we don't want to see the scar. And if your surgeon uses a technique where you can see a scar, you want it to be the best scar it can be, and that depends on experience and lack of tightness and different treatment parameters that your surgeon can do.